shock, cardiogenic and septic. Stages: initial. No visible changes. No SS, then progress to tachycardia, low BP. Only changes on cellular level. Compensatory, non-progressive. Measures to increase CO to restore tissue perfusion and O2. Progressive. Compensatory mechanisms begin to fail. Refractory. Irreversible shock and total body failure. Cardiogenic, failure of the heart to pump effectively due to a cardiac factor, decreased cardiac output. Heart attack, dysrhythmias, HF. Septic, most common, systemic infection. Bacterial, viral, fungal. Nursing care, manifestations. Warm, dry skin septic, cold, moist skin cardiogenic.
Tachycardia.
Hypotension. Tachypnea, bounding pulses.
Oliguria.
Less than 30 ml HR, Ashen pallor. Metabolic acidosis, decreased LOC. Confused, restlessness, anxious. Modified Trendelenburg. Large bore IV, greater than 20 gauge.
OE.
Mechanical vent, severe, ICU.
VSQ.
Rest, decreased movement.
Monitor, IO.
Want greater than 30 ml HR, Foley cath.
Acidosis.
Should have normal body temp, maintain SBP above 90. Labs, ABGs, lactic acid. Should be between 0.51, serum glucose, cardiac enzymes, coagulation studies. Treatment, cardiogenic, increase contractility and reduce after load, Lasix. Septic, IV fluids, vasopressors, antibiotics, low-dose corticosteroid. Spinal cord injury, population at risk, osteopenia, a condition that begins as you lose bone mass and your bones get weaker. Osteoporosis is a disease that weakens bones to the point where they break easily. Osteoarthritis, degeneration of joint cartilage and the underlying bone, most common from middle age onward. It causes pain and stiffness, especially in the hip, knee, and thumb joints. Chronic pain. Injury trauma, cervical C1-C8. 12 thoracic, T1-T12.
Lumbar L.
5 sacral S1-S5 sacral. 5 nerves and vertebrae fused. 1 coccygeal C0 coccyx. 4 nerves and vertebrae fused. Upper motor neurons UMN, injury equals spastic paralysis. Lower motor neurons LMN, injury equals flaccid paralysis. IV methylprednisolone within 8 hours to decrease cord edema. With injury the point will still have reflexes. IV methylprednisolone within 8 hours to decrease cord edema. With injury the point will still have reflexes. IV methylprednisolone within 8 hours to decrease cord edema. With injury the point will still have reflexes. Spinal shock, loss of reflexes below the injury. Decreased BP and increased HR, bulbocavernosus Osinski reflexes used to test for spinal shock. Pulling on penis or clitoris to see if rectum contracts. Neurogenic shock, parasympathetic and sympathetic are fighting each other. Low BP and low HR. Orthostatic hypotension and poor temperature control. Injury at C18 equals quadriplegic C3-C5. Injury at T1S5 equals paraplegic. Completed injury. All sensation and motor are gone below the injury. Incomplete injury. Some sensation is getting past the point of injury. Cervical, neck injuries can affect the arms, legs, and mid-body. Thoracic, chest level injuries can affect the legs. Blood pressure problems, sweating, poor temperature control. Lumbar, scrotal, low back injuries can affect both legs, bowels, bladder. Phrenic nerve, C3-5, controls diaphragm. If damaged, the patient is vent dependent. LMN lesions, flaccid bladder, urine dribbles out. Needs of Foley. UMN lesions, bladder fills but cannot empty. Self-cath, can cause kidney damage, stay dry between cath. Constipation, no bedpans cannot feel their bottom for pain. Stimulate bowels same time each day, best after a meal. Assess bowels prior to giving food. Digital stimulation, spastic can stay continent. Flaccid will dribble stool, autonomic dysreflexia. Above T6, life-threatening. High BP nifedipine, puncture gel and swallow. Upper half of body is flushed, headache, distended neck veins. Lower half is cool and pale. Caused by a stressor, full bladder or constipation. Hot spill on them. Sit patient up to get pressure off of head. Take off TED stockings. Mobility, MS and PD. Immobility. Risk for cardiovascular problems, central and peripheral perfusion. Respiratory.
Atelectasis, PNA.
Integumentary. Pressure sores.
G.
Constipation.
GU.
Renal calculi, stasis, infection. Psychological, depressed, chest PT. Deconditioned, loss of physical fitness, want to be getting up and moving as soon as you can. Risk factors, changes as we age, osteopenia, low bone mass, menopausal women, eating disorders. Chemotherapy, steroids, radiation.
Osteoporosis, osteoarthritis.
Acute chronic conditions, chronic pain, injury, trauma. Physiological process, neurological system. Signals for all movement are communicated to and from the brain through nerve impulses. Musculoskeletal system, bones, structural foundations, supports and protects, attachment sites, joints, provide stability and allow movement. Muscles, under voluntary control. Neuroassessment, LOC.
PERRLA.
Cranial nerve, VS, motor function, sensory function, tone, cerebral function. Glasgow-Coma scale, posturing, decorticate, toward the cord. Problems W cervical spinal tract or cerebral hemisphere, decerebrate, celebrate. Problems within midbrain or pons, multiple sclerosis, MS. Inflammatory disease in which the fatty myelin sheath around the axons of the brain and spinal cord are damaged, leads to demyelination and scarring. Demyelination disease. Destruction or removal of the myelin sheath from a nerve. Multiple scars in the CNS. Multiple demyelination in multiple sites. Sclerosis. Scar tissue formation. Risk factors. Age 20-40. Women more at risk than men, but when men get it, their prognosis is worse. Don't know the case of it. Men have worse prognosis. Pathophysiology, T cells attack myelin sheath.
Autoimmune.
4 types, PRMS, progressive relapsing, hospitalized, IV corticosteroids. Clinical manifestation, initial symptoms, change in sensation in the arms, legs, or face, optic neuritis. Inflamed optic nerve, weakness, double vision,
Diplopia.
unsteadiness when walking. Balance problems, main symptoms, fatigue number 1 but not initial. Depression, nystagmus, is a vision condition in which the eyes make repetitive, uncontrolled movements. Dysrhythmia is a motor speech disorder in which the muscles that are used to produce speech are damaged, paralyzed, or weakened.
Dysphagia.
Weakness, spasms, paresthesia, tingling, numbness of hands and feet, incontinent, constipation or diarrhea, urinary frequency or retention. Tremors, intentional, inappropriate euphoric state. What they are saying doesn't match how they are saying it. Plaque in brain contributes to obsessive state. Primary, secondary, tertiary, weakness,
Fatigue.
numbness, tingling, pain, bowel, bladder dysfunction, paralysis, spasticity, visual changes. Impotence is the inability to get and keep an erection firm enough for sex. Falls, injury, reduced ADLs.
Utis.
Loss of sleep, pressure ulcers, contractures, change in sexual function, loss of job, change in roles, social isolations,
Divorce.
stigma of disability, depression. Diagnosis, physical exam, history,
CSF.
slight elevation in protein levels, blood test,
MRI.
may show some plaque, multiple lesions, attacks in more than one area. VIT level, evoked potential test, doesn't tell if you have MS, just helps to determine. Auditory or visual, when you hear a noise you tell them. If you have plaque it takes longer to respond to noise. Treatment and management. Treat relapses, minimize and control symptoms. Acute attack, steroids, methylprednisolone, fast-acting.
4. Prednisone.
Oral, side effects,
Insomnia.
increase BP, mood swings, fluid retention. Emergent plasmapheresis, washing of the blood, when body makes new WBCs, won't attack myelin sheath, prevent relapse to keep remitting periods.
Interferon beta yeta, Avonex, Rebif.
IM injection weekly,
Interferon beta yeta, Bitaseron.
SQ injection daily. Side effects, flu-like symptoms, site reactions, mild liver dysfunction. Spasticity, baclofen, day.
Diazepam.
Night, triggers, cold, high humidity, tight clothes, tight shoes, constipation, poor posture, infection, cold, flu, pain, NSAIDs, muscle aches,
Gabapentin.
anticonvulsant, nerve pain,
Bladder dysfunction.
oxybutynin chloride, prophylactic antibiotics for UTI, self-cath, constipation, BC decrease mobility. Stool softeners, laxative, depression emotional, SSRIs, fluoxetine,
Paranoid mania.
haloperidol lithium,
Fatigue. Peace.
pacing, rest W activity, plan. Live in a 2-floor house, going to the 2nd floor but plan what to get so don't need to take another trip. Prioritize. Bed isn't made BC of fatigue. Position. Speakerphone versus holding phone. Amantadine twice daily. Modafinil once in AM.
Prognosis.
Not a killer. It's a crippler. Parkinson's disease, chronic disorder caused by lack of chemical dopamine in the brain caused by degeneration of the substantia nigra, more common than MS, ages 60-70, males equal to females. Causes, idiopathic, WO clear cause, don't know the reason.
Autoimmune.
Dopamine not released to the brain, clinical symptoms. Cardinal signs, rigidity, tremors, resting tremors, can get severe that affects everything you do.
Bradykinesia, frozen.
Feet can't move, teach them to rock back and forth to unfreeze. Other SS, stoop posture, mask-like facial expression, shuffling gait, arms fixed to side, difficulty W hand movement. Diagnosis, clinical picture, history, rule out other things. Do they respond well to the Parkinson's medications? No cure, treatment and management.
Cinemed.
Treatment of choice, combination of two meds.
Carbidopa levodopa.
Carbidopa protects levodopa, written in fractions. Levodopa is a precursor to dopamine, crosses the blood-brain barrier. If given alone, breaks down en route, so that's why combined with carbidopa. Surgical management, deep brain stimulation, placing electrodes into a brain. Electrodes are connected to a generator implanted in the chest and sends electrical pulses to the brain to reduce symptoms like tremors. Therapy, PT, nursing considerations, bowel, bladder, skin, respiration.